I want to talk a little bit about, for our viewers out there, a little bit about your clinic. I want to talk a little bit about the services that you offer in your clinic, and what are common problems that come into your clinic daily.
Okay.
Can we talk a little bit about that?
Sure. Well, maybe I'll answer that question first.
Okay.
I tend to see a lot of women
Okay.
looking for help with women's health care issues such as PMS, endometriosis, breast cancer, perimenopause, menopause. I see a lot of people with chronic fatigue syndrome and other multifactorial disorders like that, where it's not just one thing causing it, but a variety. So chronic fatigue syndrome, multiple chemical sensitivity, irritable bowel syndrome. I see a lot of people with cardiovascular issues, some people with arthritis and rheumatological conditions, and mood disorders. Believe it or not, there are so many natural ways to approach mood disorders such as depression and anxiety, memory disturbances.
Now, would you say that a lot of these people are under, because of the stress that we live in today? I mean, I know we live in such a fast pace in our society today. Would you say that because the stress has brought on a lot of these particular conditions?
Definitely contributes
to
it.
a lot of them?
I think so.
Okay.
Absolutely.
And so would you look at the adrenal glands in a lot of these particular patients as an example, and maybe get the adrenal glands back up to where they're supposed to be, and maybe some of these conditions will clear up? Or
Right. Like if you see someone who's been profoundly fatigued, or they have inflammatory conditions like fibromyalgia or arthritis, the adrenal glands are definitely playing a role.
Right.
Because one of the jobs of the adrenal glands, in addition to helping us to respond to stress, is as a natural anti-inflammatory. So if you don't have enough of the adrenal hormones, your body's more prone to inflammation and inflammatory states. So meaning you may have sore muscles or sore joints or...
Okay. Now,
Yeah.
now I understand you treat people from all over the world in your clinic. Wow, so they come from, say, maybe from Japan or wherever, but they come from across a board and come to your particular clinic for treatment.
It's true.
Is there any other treatment facilities out there that could go ahead and treat these particular conditions? I mean, they have to come into your clinic, or
Yeah.
are there just not that many? Or
Well, our clinic offers some comprehensive services.
Okay.
So we've got 3 doctors that practice along my lines here,
Okay.
where we are all Western trained, but we have this alternative orientation, try to use natural methods whenever possible. And then our clinic has a big chelation therapy practice.
Yes, I've heard of that.
And a large IV department.
Okay.
So chelation therapy is what we offer to some patients with cardiovascular disease. It's a procedure where a person sits comfortably in a recliner chair
Right.
and has an intravenous solution of a chelating agent infused into their system. And this has been shown to support vascular health, help repair and regenerate the arteries and pull the plaques out of the arteries.
I've heard some very, very, very good results also from that type of therapy. I know
Yeah.
a lot of people have had that kind of therapy, and they're just doing fantastic now because of it.
Yes.
And because they didn't want to be treated any other way besides chelation therapy, and
Right.
they just and they seem to be on chelation therapy maybe once every couple of years or something.
As maintenance.
Is that how it's done for maintenance? Or?
Yes. If someone has a cardiovascular disease, known disease, and they're trying to prevent having to have triple bypass surgery or an angioplasty, or let's say they've already had surgery or angioplasty and want to make sure that they don't have to do that again.
Right.
They'll come in and we'll offer them chelation therapy. And it's just, I wish I could just share with you how effective it is. It really is effective, but when I'm speaking from anecdotes. You know, I'm
Right.
speaking from the
Exactly.
people that are walking
Right.
around my office.
Exactly.
There haven't been large-scale placebo-controlled randomized double-blind studies on chelation, and I think that's where a lot of the criticism against it comes. But there have been many, many small studies on chelation that show positive results, and when you pool the data from all of those smaller studies, the results are promising, absolutely promising.
Yeah, I've read a lot about it.
Yeah.
Basically, I've read quite a few books on it, and I see remarkable results. So
Yeah.
it's interesting that the results that you're getting in your particular clinic, And just by monitoring patients or patients coming in and going on, say, alternative therapies, and they just seem to be doing so well.
Yeah.
And getting off of all, say, medications and don't need to be on any of these medications anymore. And
Well, that's a goal. I mean, sometimes
It's a great
people
goal.
need to be on small doses
Sure.
of certain medicines,
I understand.
but whenever possible, we certainly try to get people off of medicines.
Good.
Yeah,
Really, really interesting.
it is.
I want to talk a little bit about irritable bowel syndrome for a while.
Okay.
I know that a lot of people have that. They don't even know they have that.
Right.
Or it's diagnosed maybe differently than irritable bowel syndrome. I have seen that myself. What is irritable bowel syndrome?
Well, it is actually considered a diagnosis of exclusion. So what that means is, first, if you have bowel symptoms, you have to rule out some of the more serious things that could be causing these bowel symptoms. And once the more serious things have been ruled out, usually you're given the diagnosis of irritable bowel syndrome. And what the criteria you have to meet are, you have to have abdominal pain and a change in bowel frequency or consistency
Okay.
for a period of greater than 3 months. And you have to have already been tested for the other types of serious conditions.
Okay.
And so basically it's a wastebasket term. A lot of
Okay.
people suffer from irritable bowel syndrome.
Well, Dr. McDougall, we could talk and go on and on and on. And I sure would like to have you back on the show again.
Okay.
Because I would like to pick one subject and really get into one subject, say menopause, maybe spend the whole show on, say, menopause or cardiovascular or whatever, because there's so much information that you've given us just right now that it's kind of, it can be a little overwhelming, but it's such a wealth of information. It's amazing. I would like for our viewers out there, if they would like to get a hold of you, I would like to have them contact you. I know your name is going to be on the end of the show, okay? And I know you have a website. Can they get something on your website to give some information about your clinic?
Absolutely, absolutely. Our website is www.sfpmg.com, and that's San Francisco Preventive Medical Group.
Great. Now, for our viewers out there, if they need to get a hold of me for any reason at all, my name will appear also at the end of the show, and Dr. McDougall's website will appear at the end of the show, and her address at her particular office. What a wealth of information. I sure hope that you viewers have enjoyed this particular show. I'm going to have Dr. McDougall on again. We need to have her on again because she has a tremendous amount of information that we need to hear. And again, I wish all of you children, I wish all of you viewers and your children the best of good health. And we'll see you again. Interesting show.
It's good.